Hi, my name is Nguyen. Currently, I'm doing my final clinical rotation at Wayside Health Adult Center in Sudbury, Massachusetts. Today, I'm going to talk about type 2 diabetes with renal complication. This is the agenda of my presentation. First, I'm going to introduce my patient, ID, GJ, date of birth, 01/12/1958, a Hispanic male, come to the clinic for follow-up of his elevating fasting blood glucose and decrease the estimated glomerular filtration rate after his annual exam 10 days ago. His chief complaint is, I had my lab done after my physical a week ago. I got a phone call to come back to the clinic for my blood sugar follow-up. HPI, he's a 66-year-old Hispanic male, present to the clinic for a follow-up appointment. And this is the physical after 4 years. His blood sugar is 148, A1C 7.6, EGFR is 55, BUN 29, creatinine is 1.8. He also informed that his lipid panel results are out of normal ranges. His total cholesterol 220, LDL is 188, HDL is 49, and triglycerides is 178. He has a medical history of diabetes and hypertension, that he has been taking medication. And regarding the complication of diabetes, he reports increased frequency of urinary. He denies polydipsia. He denies fatigue, tiredness, eye blurriness, or the eyes problem. He denies headache, numbness, tingling, fever, chill, malaise, rash, chest pain, shortness of breath, abdominal pain, significant weight loss or weight gain. For hypertension and diabetes, that are his medical history. He's taking amlodipine 10 mg once daily and metformin 1000 mg once daily. He denies any medication or food allergies. Family history include his maternal grandfather has type 2 diabetes. Social history, he denies smoking, vaping, drinking alcohol, or using any other drugs. He reports not exercise regularly. He walks his dog about 30 minutes every day. His diet: for breakfast, he usually have toast with egg or sausage. For lunch, he has whatever fast like hamburger, pizza. He has a home meal cooked dinner with protein and some vegetable. He has no sleeping issue. However, he reports that he's having moderate to high stress level related to his job as a project manager. Review of system. He denies any skin, ENT, respiratory, cardiovascular issue. He reports increase of urination, denies burning pain, pressure at bladder side, denies increased thirst sensation. He denies neurology issue. Physical examination, vital sign, pulse 76, blood pressure 132/77, temperature 97.9, respiratory rate 18, O2 sat 99 on room air. He has no pain. His BMI is 26.6. His labs were discussed at the HPI. Physical examination are unremarkable. He appears comfortable, no distress, no abnormal odor, no difficulty with mobility. My differential diagnosis for him: first one is type 2 diabetes mellitus with diabetic chronic kidney disease. Because of the clinical presentation of uncontrolled type 2 diabetes with elevated A1C, elevated plasma blood glucose, and decreased renal function based on the laboratory test result. So this diagnosis can be as the one of the appropriate diagnosis. The second is metabolic syndrome. GJ demonstrates clinical manifestation of metabolic syndrome including plasma blood glucose greater than 75 percentile, triglycerides 178, and his blood sugar is still elevated. And according to the Endocrine Society, this is an appropriate diagnosis. The first one is stress-induced hyperglycemia because of his reports of high stress level related to his job characteristic that make his blood sugar elevated. So this is one of the appropriate diagnosis. My final diagnosis is type 2 diabetes mellitus with diabetic chronic kidney disease because of his uncontrolled diabetes, which result in decreased renal function based on the GFR of 55, which is abnormal. My treatment plan is I'm going to add Farxiga 5 mg pill once daily for him. This is a good choice of medication. This medication belongs to SGLT2 inhibitors class, which is recommended for type 2 diabetes patient with chronic kidney disease and can help patient to reduce incidence of cardiovascular events. And he doesn't want to use any medication for his dyslipidemia. So I'm going to focus on lifestyle modification, including I'm going to prescribe aerobic exercise, resistance training for him so he can do every day to 30 to 45 minutes. And I'm going to encourage the Mediterranean diet style, which focus on vegetable and fruit consumption for better control of metabolic failures. Next, I'm going to discuss about the treatment plan for this patient. Regarding the diagnostic testing, I'm going to order the urine and albumin to creatinine ratio to evaluate and confirm the chronic kidney diagnosis. Also, I'm going to recheck his lipid panel and HbA1c in 3 months after implementing lifestyle modification interventions and pharmacological treatment. For referral, I'm going to refer him to a nephrologist with the lab results for long-term management of his kidney problem. Regarding education, I'm going to talk about the side effect of the Farxiga, and also I'm going to educate him about the negative impact of untreated or uncontrolled type 2 diabetes related to cardiovascular event, renal implement vision impairment. So he needs to be adhered to his lifestyle modification as well as his medication regimen. And also I'm going to talk to the family member to support the lifestyle change. For follow-up, I'm going to see him in about 8 to 12 weeks to evaluate the new medication regimen. The meaningful learning opportunity after this patient encounter, I realized diabetic complication rate is increasing globally. So the management strategies need to be implemented at individual levels by patient education of self-care at every visit, and also at the community level. We can organize the educating workshop campaign to improve the public awareness about diabetic and related complications. Regarding the holistic care approach based on Washington Caring Science Institute, I apply embrace or loving kindness to sustain humanistic, altruistic values by practice loving kindness, compassion. And also the Caritas field focus on creating a healing environment for the patient. So I need to talk to the patient with no judgment attitude and offer them choices that they want to implement in the plan of care. And that care should be based on trust or transpersonal and need to be sensitive to self and others by cultivating my spiritual practice. And the nurture relationship focused on developing and sustaining loving, trusting care relationship with the patient. Ways that my care of this patient representative a holistic approach. I believe I integrating his medical history, his lifestyle, and his personal reference into developing plan of care so that he can feel comfortable that his care, that he's involved in his care, and I will monitor his health status after the plan is implemented to make sure that the plan of care is effective. Thank you so much for listening.